and welcome to Summer Road Trip Wellness, like the things that you absolutely have to have. I just wanted to say, are you going on a family road trip? Anybody taking a vacation here after COVID? I know we're all trying to get out and it's so exciting. I will tell you that if you are going on a family road trip, one of the worst things that could possibly happen is you get an upset stomach, you get motion sickness. But how do you save your car, right? How do you save the seats? What do you do just in case? Well, there is a 30-second solution, but first I want to get to introduce myself. Hi, my name is Dr. Jacqueline Darna. I am the CEO and medical inventor of NoMo Nausea, NoMo Migraine, and NoMo Sleepless Nights. The only 3-in-1 essential oil infused acupressure wristband that can instantly stop your worst upset stomach, headaches or migraines, and even sleep problems, all right? I am a doctor by trade, turned entrepreneur just a little bit over 5-6 years ago, and we've taken the world by storm. So my products, which are called NoMo Bands, as you can see that I'm wearing them, NoMo Bands are actually found in hospitals, in over 1,000 hospitals in the US, and then 12 different countries of the world. Then, of course, all my mamas out there, all the pregnant moms, and all of the moms who suffer with their kids with car sickness, they were the ones who came out and said, hey, Dr. Jackie, is there any way that you can create something for my kids? Something I can go pick up at your local CVS store or different types of pharmacies? Well, yes, that was the whole idea. So we created our retail brand, which you can buy right there on Amazon right here. So again, you can see that there's a variety of different colors. And I'm going to use blue because blue, in my essence or my opinion, is kind of what is best or most related to for summer road trip, right? It's that really refreshing, it's that cute color. And so we're going to kind of go through a bunch of different entities of why it is that it works, okay? So number one, we have a fast-acting approach. So I know you've probably seen your old, grandma wristband acupressure band. They're not cute. You wouldn't catch me dead in heels on a cruise or on a road trip with those ugly type of bands on. But the difference is it's not just stylish. It actually has a purpose. And the way that it has a purpose is what I call fast-acting aromatherapy. So yes, you just take it and you smell it. So that smell will instantly stop your worst upset stomach, and also it gets into your brain the fastest way. How? Through your nose. So that's the smell of it. And yes, we do use medically sourced essential oils, and we use what's called a distraction technology, because in the hospital, what is the best way for a patient post-surgical to stop nausea and vomiting? Well, it's to trick the mind out, right? So you're actually applying these different concepts of a cooling sensation on your wrist to make you forget that you were sick in the first place. And then the third and final is the long-lasting effect. Yes, I did not invent acupressure, but when you apply acupressure on different acupoints that are found all over the body, it elicits an actual response. So this response, or what it is a quick, you actually apply pressure and it increases what's called your beta endorphins. So those endorphins are happy hormones, and those happy hormones actually help your body to bring on happy hormones before you get on a boat, a plane, or a train. So you can actually stop motion sickness beforehand. But don't worry if you're that person who gets in the car, you're going up the mountains like I did whenever I went skiing recently. I will tell you, I had the worst altitude sickness, and everyone's gonna sit here and ask me, does it work for altitude sickness? Yes. So again, we are found in 2 different sizes, which are pretty awesome. I'm actually going to use this one just to show you. I am what's considered an adult, okay? An adult wrist, AKA large. Sorry, ladies, it is medium large. I will say that. And let me flip to the actual product here, just for the girls, nice and pink. The products that it is, regardless of the color, all does the same thing as long as it says NoMo Nausea, okay? And so again, the sizes, we have one that's a large size, and Then we have them for our petite ladies and gentlemen. Hey, now, I'm not trying to discriminate. Some people are small, but look how much they stretch, okay? So they really do stretch, but the big difference is the actual ball shape that you're going to see. So see how little that is? Okay, and now take a look at this one. That's definitely a nice little hunker, and I'm gonna help you find your acupressure point right now before we get into anything else. So again, all you have to do is you take your 3 fingers, so 3-finger distance, and you goes after the first wrist crease. Now I want you to wiggle your fingers just kind of like a bunny rabbit, and wiggling them in between your first 2 tendons. Boom, you found it. That's it. There's nothing else that's too exciting that you have to do. You just apply it and smell it when you need it. That's the beauty of NoMo Bands, right? Okay, so let's get into summer road trip essentials, of things that you have to have and why, because everybody always asks me as a doctor. So number 1, why do people get motion sickness? Okay. Number 2, we're going to go into how does acupressure help to stop it? So what are those methods and modalities? We kind of quickly talked about, you get a little bit of these beta endorphins, but what does it really actually do? Third, why are NoMo Bands different? So again, here's the hint. They're not just cute. There are a purpose. Right? It stops it instantly. We have 11 clinical trials proving our efficacy, meaning we can stop 80% of people from getting sick, nausea, or vomiting in just seconds, which is amazing. But they're waterproof. Oh yeah, did I mention I could spit on it, I could sweat on it, I could literally rain on it with my hand outside of the car door as you're cruising along, and it works for dogs too. So yes, we have our dog band as well, and I'm gonna end up doing an Amazon Live on that one too, so that's pretty cool. And then the 4th thing is, why do traditional medications like pill popping, why doesn't it work for motion sickness? Because you see all of these brands and what happens. So why don't they actually work? So let's get straight into it. I want to say thanks to a few of those guys, or you guys, for watching. Again, if you have questions, please type them in. I'm happy to get to them. Again, I'm the doctor that asks me anything, right? The doctor is in. So let's first go take a look at, so why do people and dogs get motion sickness? Okay, so you actually have what's considered your, and I'm going to move this here so that you guys can see our different actual anti-nausea products in different colors as I talk about it. The first thing is, when it comes to motion sickness, we have what's called the puke center of the brain. The puke center of the brain is also known as the CTZ, okay? It's the chemoreceptor trigger zone. So that is actually found in the brain. And the way that we found that is we did studies on dogs, and they were actually able to take a needle and poke that spot. And what happens with that spot is, as soon as that spot was poked in their brain, they started immediately dry heaving. That doesn't always mean, so nausea doesn't always equate to vomiting, but in most cases, nausea is like the waves, and then vomiting is what happens thereafter. So what happens is you actually have this nausea receptor, these chemoreceptors, okay? And what they are is there's multiple of them. There's actually 5 in the brain and 2 in the stomach. And I am proud to say that we help to stop 4 out of those 5 receptors get excited in the brain, and 1 out of the 2 actually in the stomach area. And I'll go more into how that actually works. But it's important that people understand that motion sickness can be caused by a wide variety of things. Okay, so if you're a person that ends up getting like inner ear problems, I have vertigo. It was awesome. After I hit 30 many years ago now, I got horrible vertigo, and it was after my beautiful daughter. So I do not suffer from inner ear vestibulitis anymore, or I should say, but there's multiple different causes. Some people actually get really bad headaches, which all kind of come back around to that one. Headaches and migraines that are triggered from the back itself, and that's because of the fact you're cervical. You can actually have what's considered cord compression. They do a little jimmy right there, and what happens with cord compression is, oh my gosh, all of a sudden you get really bad headaches and migraines because the actual nerves are firing. And if you're one of those people, guess what we have? We have NoMo Migraine. Yes, you're gonna love it, but I'll do a completely different Amazon Live on that one. So At the end of the day, whenever your body is trying to respond to things such as medication side effects, that happens too. The chemoreceptor, that puke center of the brain, is the center of all of these different signals. And whenever you're signaling, either your eyes are not matching your ears, which are not matching your feet, meaning you're either using 3D goggles, you're being slung around on the Gravitron or whatever it's called, from a carnival ride back in the day, all of those things can attribute or cause motion sickness. Now, some people have more motion sickness. And if you're like me, over 30, not too far, but if you are over 30, guess what? The cilia in your ears, because of all repeated these banging concerts, all these other things, I will say, guess what happens? They start to lay flat and they're no longer able to kind of pick back up like they used to. So you have an increased chance, and geriatric patients, elderly patients, you will start to have bad motion sickness. I'm so sorry for telling you this. And it's not a good time because you're probably already taking medication for hypertension, diabetes, high cholesterol, heart, blah, 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 so on and so forth. And a lot of the medication side effects are nausea and vomiting. So why take another pill? Why take something else? Instead, you can literally go and just throw on a band. So I'm going to put this up there as well, just because we have a variety of different colors. So that's the reason why you get motion sickness. Okay, and so a car is no different, right? So if you are driving in a car and you're seeing your eyes, you're actually seeing through your ophthalmic that the car is moving, but your body is physically stationary. So as you're looking, as you're looking out beside yourself, if you start to try to target and focus, it's going to be an actual moving body. And then your ears try to regulate you saying, okay, am I moving? Am I not moving? It's kind of like when you're stopped at a car and then the car moves forward. What do you feel like? Whoop, you feel like you just moved back, right? Well, that's because your interbody senses and your nerves are trying to talk to each other to figure out what's going on here. So that is kind of the reason why people get motion sickness, especially in cars. Kids. Oh, I get to talk about my kids. NoMo Nausea Kids Band. I did not put that on the actual screen, but you can buy the kids band in any color that you want, okay? So again, let's take up for the little guys. And we actually do have a specific kids one. It's same color, does the exact same thing. The only difference is that people are always looking for something for their children. So we had to repackage and brand, which is perfect. Okay, so NoMo Nausea Kids. The reason why kids get motion sickness more frequently, the reason why is for a bunch of different reasons. Number one, because their actual ear tube, this is the reason why kids have to get ear tubes, which is a procedure done, but they lay flat. And so imagine there's liquid inside of there, it gets stuffy, it gets in there, and then they get constant chronic infections. Usually by about 6 to 7, their ear canal starts to kind of lower downward or angle more, so then it can help to drain that better. So I'm only making mention of that because what happens when you go on an airplane and you're already sick, which I hope you're not doing, and I hope you're wearing a mask. But if you are, again, what happens? Your nose, right? Your ears get plugged because of the change in the actual pressure that you're sensing. Well, that change, if you're not able to regulate it through pressure, guess what happens, right? Just like kids, it falls stagnant. It falls right here. They have an increased chance of having complications in their inner ear. And what does inner ear problems cause, like we talked about? Motion sickness. So that's the reason why kids actually have more affinity for motion sickness than adults do. And then the after end period where you become a baby in your old age, right? You actually have an increased risk as well. So those are our big prime targets. Make sure you got something for the kids, because trust me, mamas, you do not want to clean out a car seat after a very long road trip, and it smells forever. You can never get it out. And then also for your moms, your dads, the people that you are, we're the panini, right? That's what it's called when you're sandwiched in between two generations and you're taking care of both at the same time. So always look for them. We're also utilized for cancer patients, oncology, radiology, things like that. So it's not just for pregnant mamas and it's not just for summer road trips, but that is the reason why you end up getting upset tummy. Okay, so secondary, let's talk about how does acupressure help to stop it. So I kind of briefly made mention of why NoMo Nausea was so amazing. Well, because of the fact that it targets 4 out of the 5 receptors in the brain. So what happens is your brain is coded, right? And it's got multiple different signals. Your brain is like a popularity contest. Okay, so whatever the majority rules. If you have an acupressure band on, which you can do it without a NoMo Nausea Band, if you have time, I don't know how you do, but if you do, come work for me. No, if you do have time, you apply pressure. You can take a peanut or something that's like hard, and you can apply pressure on there for 5-minute intervals for at least 15 minutes. So 5, you would then like release it for a second, 5 more minutes, release it for a second, and 5 more minutes. And in about 45 minutes, your body will start to circulate these beta endorphins or these happy hormones so that you don't get sick before you go on a car trip. The problem is you have to maintain constant pressure. And I also want to show you guys just real quick, I'm going to get kind of close here to the camera. So how much pressure do you need? Everyone thinks that you need a lot. You don't. It's the amount of pressure. See how my nail bed has changed? This band automatically adjusts the actual force and pressure needed upon your wrist. So please make sure that you get the right size. And by the right size, I mean most of you who are adults will be the adult band, aka the large band. And the small, which is the petite, are for anyone who's under about 3.5. Look how cute this is. So 3.25 up to 6.25 circumference, and this one is 6.25 and above. All right. C, here we go. So why are NoMo bands different? Well, because we are stylish. We're waterproof. Okay, this was like a big difference. That for me, I had used other acupressure bands before I invented mine. And yes, they do work. The problem was they got gross. I would sweat all over them. I wouldn't be caught dead literally in my heels on a cruise with that because, you know, you have very stylish outfits. And that's the reason why I have all of these different colors. So I'm going to just keep flipping through some colors here as we talk about them. But it's to match all of your outfits. They do the exact same thing, but it is important that you guys know this NoMo Nausea Band can actually stop 80% of people from having nausea or vomiting in seconds. And guess what you have to do? You smell it. So it's not just that beautiful aroma of peppermint essential oils that we actually derive from our medical sources, and we actually have the highest concentration of the active ingredient, which is actually menthol. And again, it is wonderful and safe to use. If you have peppermint at home, awesome. But that's why I priced it appropriately. $12.99, guys. So you go, you buy it, $12.99, you use it. It's good for 5 years inside of this package. You heard me right. I said 5 years before you take it open to it here. 5 years inside here, you're good, you're gravy. All right, when you pull that sucker out, okay, if you use it for 2 weeks of continuous use. So basically a package is good for about a month, but don't leave it out, right? You want your body, your skin, everything to absorb the essential oils in the maximum capacity. When you're done with it for the day, let's say that you took a quick Key West Express. I'm in Florida. So quick Key West Express, you go, you use it, you take it off, you put it back in the package, and it'll be good for lobster season next year. All right. But even better, if you guys want to support this woman-owned business, please keep buying them and buy them in different colors because you never know which outfits you're going to end up choosing there later. All right. So next, let's take a look at, let's just do a quick live break. Okay. Hello. I see. Hi guys. Thank you so much for joining. So if I didn't give me your question. So if I didn't get to your question, perfect. Thank you so much for wanting to purchase it. Curled hair. Yep. I get it from my mama. Literally, I woke up like this. So yes, I am Peruvian. I am a Peruvian physician. So unfortunately, this wild mane hair comes with the territory a little bit hard to maintain sometimes, but you know, when duty calls is the most important. So if I didn't get to your comment, your question, please let me know. Another thing is click on the reaction button, click on the hearts. Like I want to see like some love because it keeps me obviously going to be able to see you all as not just my customers, but also as patients too. And if you do love me, your favorite doctor, right? Whether it's your favorite TikTok doctor, Amazon, all the other stuff, follow my brand. So again, NoMo Nausea, NoMo Bands. whatever it is, go follow it, because especially here, you can get notifications every time, and I promise nothing will be the exact same. It'll definitely come out with brand new, fresh material. Let's take a look at even more colors, options that you can have, and you'll get up to date with further live streams, just because whenever I go live, it's because I have a break in between taking patients themselves. All right, so the very last part is why don't traditional medications work? Well, here we go. So your chemoreceptor trigger zone, which we talked about in the beginning, is kind of like the puke center of the brain, right? And it lies outside of the blood-brain barrier. Whoa, what does that mean? Okay, so let me break it down. Basically, everything that you have is kind of like in sections and in barriers, okay? And so what happens, the blood-brain barrier, so blood obviously goes in, transports, whether it's beta endorphins or medications, then goes, and some medications permeate through to the actual brain and cause it to change. And by that, I mean things like, if you've ever heard of a patch, right? Scopolamine patch. If you've ever heard of other medications like atropine or things like that, those medications will cross through the blood-brain barrier. Well, your puke center is outside of it. So why are you trying to get all the way in, right? So it'll just cause you to be sedated. It'll cause you to be tired. I mean, all these things, it's this exhaustion. And do you want that when you're taking a summer road trip? You definitely don't want it if you're driving. But even worse, if you're trying to see the scenery, don't just subject yourself to pop and Benadryls, right? And the reason why is because, again, how do you not puke when you're on medication? Well, you sleep. Are you puking when you're sleeping? No, that's the reason why they try to take your money, which is great. Instead, go natural. So try something. Utilize medication when they're needed as an extra, or as what I call a rescue antiemetic, meaning a rescue response. And having that rescue response, you can actually help to combat it beforehand, applying that pressure to the P6 point like we talked about, or just by utilizing smell. So the combination of those two things, the actual essential oil infused acupressure device, is the reason why NoMo Bands are utilized in thousands of hospitals and in 12 countries of the world. So somebody had just asked here, does alcohol help or exacerbate the issue? Well, the reason why you have a hangover is actually not due to the alcohol, but it's actually due to dehydration. So your brain, the meninges, you kind of have, imagine your brain is kind of like floating in this nice little CSF. It's like a fluid. And at the very top of it, it's these hair-like functions that are connecting the actual skull to it. And normally it's like floating because you're nice and hydrated. Well, guess what happens when you drink too much? You have a nasty hangover and it pulls. Well, as it sags, those meninges sag, and it's a referred pain. Your brain doesn't know how to refer brain pain. So brain pain is shown in multiple different ways. Horrible headaches, you end up starting to get nauseous, some people end up vomiting. But yes, alcohol is absolutely, it exacerbates the actual issue of motion sickness, because of the fact it doesn't allow your vestibular counter, so your actual ear and your eyes, to coordinate appropriately, especially if you've had over one alcoholic beverage. So yes, no Benadryl, Poly-Z, perfect. All right, so don't drink before a long road trip. Makes sense, yes, even as a passenger. Instead, grab a NoMo Nausea Band. Honestly, it works for hangovers too. I don't know if I'm allowed to say that, but who cares? It's my live stream. I was just in Nashville, and that was the sole purpose. It really worked, I must say. All right, so yes, don't drink. And now is the baby. I don't know. Thank you so much for the love of me saying that I'm beautiful. I really don't think so. So I greatly appreciate it. And where can you buy it? Yes, you can buy it. Go to Amazon, guys. It's the easiest way. Honestly, Amazon's amazing. Or you can look at NoMo Bands. We are found in 30,000 retailers, but that's not what's important. I want you guys to all literally go to Amazon, type in NoMo Nausea, boom, you have now gotten the absolute best place to end up getting it. All right, so I think we've kind of covered everything. You guys know all about a summer road trip, okay? What to do, what not to do. Definitely don't start drinking before you go on your summer road trip, but also the reasons why you get motion sickness. Not just why you get motion sickness, but why sorry to say this, why stupid people, right? They choose medications which are not going to actually target your motion sickness receptors. Instead, they're just making you sleepy. But there are natural alternatives, and those natural alternatives, choose something that's a 3-in-1. Choose something that's cheaper too. I don't know about you guys, but $12.99 sounds like a really, really, really great endeavor. And does closing your eyes help on a road trip? Actually, I'm going to talk about that real quick. I just saw it right on the screen. So the best way to get rid of seasickness is jump in the water. Woo! Okay, I know everybody's looking at me like I'm talking about a road trip, but the reason why is because it'll help you to help equilibrate your ears, your eyes, and everything in between. So if you're going at the same time, closing your eyes does not help. It actually confuses your brain a lot more. But you know what you can do? Take off your shoes and socks. Yes, sorry if you have stinky feet, you may want to wash them before a long road trip. But what you need to do is you need to ground yourself. And by ground yourself, I mean physically touch the floor, and that actually helps you to align your brain with where you are. So if you're inside the car, if let's say the room is spinning, if you're a person like me who has horrible vertigo, woo, there I go. What I do, the best thing that I do, after throwing on a NoMo Nausea Band, I literally will put my feet up on the ground and I make sure to pick a spot. So whatever that spot is, do not pick a moving spot. Pick a spot that's not moving. All right, here. Yes, so get a mani-pedi before the road trip, especially if you have crappy, if you have nice, not very good feet. Well, thank you guys all. Thank you guys all for joining on this live stream. That was really fun. This is the first one that I've ever done on Amazon Live, and my company has been begging me to get on live because it's kind of fun, and I do unfortunately love to talk, but I have to get back. I have a meeting at 11:30. So again, don't forget to purchase your NoMo Nausea Bands. Go to Amazon, type in NoMo Nausea, and for $12.99, you don't ever have to have car sickness or any type of trouble with the summer. Thanks again. My name is Dr. Jacqueline Darna, CEO and medical inventor of NoMo Nausea, NoMo Migraine, and NoMo Sleepless Nights. The first and only essential oil infused acupressure wristband that instantly stops your worst upset stomach, headaches, migraines, and sleep problems in seconds. All right, guys, until next time, thanks again. Thanks for watching.